Diabetes mellitus type 1 or juvenile diabetes. The main cause is destruction or self-killing of beta cells of pancreas. Meet Tom. Over last few weeks, he has started to notice polydipsia following frequent urination and polyphagia 3p. Another symptoms of diabetes include hypertension leading to myocardial infarction, which clinically manifests as a painless but a lethal result, and atherosclerosis. Gastrointestinal problems include heartburn, gastritis, inflammation, etc. Diabetic nephropathy, kidney diseases, include cystitis, increased volume of urinary bladder, glomerulonephritis, etc. Osteoarthropathy includes limited mobility of joints. Eye problems include cataracts, retinitis, etc. For diagnosis, we can measure the level of glycated hemoglobin, HbA1c, C-peptide, and also, glucose tolerance test or GTT can be used. Instrumental methods may include glucometers with test strips. The level of ketones, glucose, and albumins can also be checked to cross out the possibility of ketonuria, glucoseuria, and microalbuminuria respectively. One of the main cause of diabetes type 1 is autoimmune or genetic. Another factor that contributes may include infectious. It is usually seen in children due to low resistance of child to viral or another infectious agents. To testify the autoimmune nature of diabetes, antibodies presence can be checked and increased level of T killer cells, etc. Insulin injections can be given according to basal bolus method depending on the severity of the disease. Sometimes, pancreas transplantation or islet cell transplantation can also be useful. The disease is acute in onset and develops rapidly with severe complications like ketoacidosis and microangiopathy and decreased insulin production resulting in further complications. For the prevention of diabetes type 1, immunosuppressive agents like cyclosporine can be used, but it has side effects associated with it like kidney toxicity. However, diet changes like breastfeeding a child decreases the risk of diabetes type 1, and giving children vitamin D daily during their first year of life is also said to be associated with reduced risk of type 1 diabetes.